Welcome, Texas Optometrists, to Professional Responsibility 2019. My name is Dr. Kyle Sandberg. I'm an assistant clinical professor here at the Rosenberg School of Optometry. This is the 1-hour course in professional responsibility or ethics that's required each year in order to renew your license in Texas. Since you're taking this course online, the other thing that you need to note is the course is accompanied by a 10-question quiz that you must complete following this presentation. Once you've completed the quiz, you need to submit it to the Rosenberg School of Optometry CE department along with your payment for the course, and once the course quiz is graded, we will submit that to the Texas Optometry Board and you will receive credit. Just a quick note about this course: the topics covered here are sent to me or to the school by the Texas Optometry Board. They are similar to some subjects that we've covered in the past several years, but if you've never taken the course before, this should bring you up to speed on important things to know in Texas optometry. So without further ado, let's go ahead and get started. I remind you each year that the Texas Optometry Board maintains a website. It's a great place to check your CE. It also has a link there at the top for optometrists. There you can find different board rules as well as the Texas Optometry Act. So throughout the presentation, I'll reference board rule numbers and sections of the Texas Optometry Act. If you're interested in looking at what the actual language looks like, if I haven't included it, please take some time to find it there. Alternatively, you can obviously just Google these board rules and sections of the Texas Optometry Act. I want to just point out a couple things here. The CE link is important because that's where you'll track your CE throughout the year. The other thing we want to point out is the peer assistance program, and we'll discuss that a little bit more at the end of the presentation. Concerning CE, here's where if you click that link in the top right, here's where you check your hours. You just follow this link right here. You'd enter your license number here, just the numeric characters from the license number, not the T or the G. That will finally bring you here where you can see your hours. Notice we've got our ethics hours over here, our diagnosis and treatment hours right here, and then regular hours here. You have to have 16 hours total. One of those has to be in ethics or professional responsibility. 6 of those have to be in diagnosis and treatment of ocular disease. And the other stipulation is that only 8 can be internet hours, or another way of saying that is at least 8 need to be taken live and in person, and only 4 hours are allowed to be received through grand rounds presentations at one of the schools of optometry. So long as you've satisfied all those requirements, we end up with the total 16 hours here, then you're good to go to renew your license. While we're on the topic, I want to talk about submitting CE to the board. So CE certificates can be mailed to the board, faxed, or emailed to the board. It's important to note that CE presentations are not always directly communicated to the board. So if you attend the CE presentation, the organizer may or may not be sending that information to the board. Especially if you're out of state, it may not be on there. If it's directly reported to OE Tracker, that's an easier way to see all of your CE, but even some programs don't report to OE Tracker. So it's important that you keep track of your own certificates and mail those to the board, and do them as soon as you're able. The board receives a flood of emails, faxes, and things like that as far as CE certificates are concerned near the end of the year. So if you get them in early, they can be posted to your account and you'll know that you're where you need to be. You have to take the CE and you have to have your CE requirements within that calendar year, otherwise you cannot renew your license. Starting January 1st, if you do not have your license and you are practicing, you are considered practicing optometry without a license. Despite what CE hours you may think you have taken, you need to show that you have actually been there and submit that to the board. Here's an example of the CE approved courses by the board. You can see that there's a few different categories here. Well, they've got some in diagnosis and treatment. We've got the PR or ethics column here. And so all these courses are obviously approved by the board already. If you take one of those courses, you need to just make sure even though it's approved, you have to get credit for it. As a reminder, the TOB meets in February, May, August, and November, and so you may not see newer courses reflected on this list until after the board meets to approve them. I want to mention one more really important thing on the website. I mentioned the optometrist's link already, so if you go up here and click this, it'll take you to this page. Down here are the newsletters. The newsletters are typically published in August of each year, and what they detail is a number of different things, but importantly, changes in board rules that happen, information that optometrists need to know. A lot of that actually is covered in this course, and I try my best to review the things that are in the newsletters, but the board assumes that every single optometrist in the state of Texas is reading the newsletter. It's not their responsibility to send you an individual mailer or an email or anything that details changes in the board rules. This is the primary way that the board communicates with its optometrist members. So please take the time and read through those newsletters, because there's a lot of very interesting and important information that takes place in the newsletters. I want to start this year with a topic that we've covered in the past, and that's the PMP, or the Prescription Monitoring Program. This is a database that's maintained by the Texas Pharmacy Board. Its intent is to track patients that are getting prescribed controlled substances, and it's in response to the opioid epidemic that we've all certainly heard about in the past several years, decades or so. What it's going to require us to do is, starting September 1st, 2019, if you dispense opioids, benzodiazepines, barbiturates, or carisoprodol, or Soma, you need to access this database before you prescribe to the patient. Here we see some statistics regarding the opioid epidemic, and this is really the main driving force behind requiring optometric glaucoma specialists, and really all practitioners, to access the PMP before they prescribe any of these opioid drugs. We know that there's a problem with people not only becoming addicted to these medications, but also causing a large number of deaths. Here's some additional data that's showing there are 3 waves of the rise in opioid overdose deaths. Prescription opioids probably started climbing first about 20 years ago, and then there was a rise in heroin overdose deaths. And in the past 5 to 6 years, we've seen a rapid increase in synthetic opioid overdose deaths. Again, this is just more information that's supporting why they're requiring all these rules with the PMP, and you'll see that actually they're pretty extensive as far as the documentation goes, but this is the driving force again behind it. In order to access the PMP, you first have to register, and the registration is at texas.pmpaware.net. I didn't mention it on the other slide, but I think I had it written out that you cannot register unless you have a DEA number. So if you don't have a DEA number, you are exempt from registering for this program. If you do have a DEA number, you're absolutely required to register for the program, so it's important that you do it now and be prepared as September 1st of this year approaches. The goal of the program is to limit doctor shopping, and I'll show you what the interface looks like on the next slide for my personal login, but it's pretty easy to use, and what we're really looking for is patients that have gone to multiple doctors and are trying to get these drugs from different providers. This is what it looks like when you log in, so it's a pretty easy user interface. I actually don't have any patients in here. Texas optometrists don't probably prescribe a lot of controlled substances, but certainly if you needed to or you felt like it was appropriate, this is the first thing you do when you check this PMP database. Your patient alerts would show up there, and your dashboard or any requests you had made would show up here as well. So again, we're only looking at Schedule 3, 4, and 5 analgesics. You must, number 1, look at the PMP. And number 2, you're required to make a determination whether the plan prescribing will constitute a potentially harmful prescribing pattern or practice. In addition to looking at the PMP information, you have to look at the nature and intensity of the pain, current and past treatments for the pain, underlying or coexisting diseases and conditions, history and potential for substance abuse or diversion, and the presence of one or more recognized medical indications for the use of the controlled substance. Failure to properly do this is actually reflected now as a new part of Rule 280.10, and it says that if you fail to do any of these things, it's a violation of the Texas Optometry Act, specifically Sections 351.501 and 351.551. It says that an optometrist must do the following in order to prescribe a controlled substance in Schedules 3, 4, and 5. And number 1 is documentation of a physical exam and a chief complaint relating to the pain. The other thing is really the documentation, and we really discussed just a second ago what the documentation needed to detail, but it's important that you write all that stuff down as far as intensity, past treatments, etc. But that's actually detailed in the rule, so make sure that you're taking all of that down if you're going to do this. And of course, accessing the PMP. There are some interesting exceptions to accessing the PMP. So you must do it in all scenarios unless the patient has been diagnosed with cancer or is receiving hospice care. This has to be noted on the prescription when you write it. And the other one is if you really try to comply with the PMP access, but because of circumstances out of your control, whatever that may be, it doesn't really define what that is. But if you make a good faith effort to comply with PMP access, but you're not able to, they would consider that an exception to accessing the PMP. So discussions and documentations when you're prescribing these are important, and the discussions that you need to have with your patient include the diagnosis, the treatment plan, the anticipated results, the therapies that might be available instead of the drug, and that might include physical or psychological techniques, the potential for side effects and how to manage them, adverse effects, including the profile of the drug for dependence, addiction, tolerance, and withdrawal, and the potential for impairment of judgment and motor skills. So again, all of those things have to be discussed and documented when prescribing controlled substances. So the board may open a complaint against you as an optometric glaucoma specialist if they identify some potentially harmful prescribing patterns. The way that they're going to do that is look at sheer quantity of Schedule 3, 4, or 5 analgesics that you prescribe, the patterns that you prescribe them in, or prescribing combinations of drugs. If they look at the data from the PMP and you are in the top 20 prescribers in the state at any time, they may consider that suspicious. The exception to that, and they write this out, is that an optometric glaucoma specialist that's prescribing drugs to treat cancer patients or in hospice facilities might be taken out of that top 20 prescribers list. If there's any complaints from individuals that come to the board, they may include that. Those could also come from law enforcement or healthcare regulators. If there is a patient overdose or death that's related to one of the things that you prescribed, or if you've been arrested because you've prescribed these substances. So any of those things obviously would make the board sort of perk up and look at taking some action against you. We're going to take some time here to review office inspections by the board, and this is really to just alert everybody to what those inspection procedures look like and how you can avoid fines or any action taken against you by the board. So note that the board's been doing this for over 40 years. The process of an inspection of your office generally only takes about 30 minutes. The inspection results are submitted to the Texas legislature and acts as important evidence that the TOB is actively regulating optometry in Texas. So this actually was really important in 2017 when we were trying to defend the existence of the Texas Optometry Board and not have it rolled under TDLR. This really shows that the board is actively policing the profession and doing a good job of it. So while it may be annoying or practitioners find it to be a nuisance, it is important when we look at how the Texas Optometry Board is allowed to regulate the practice of optometry independently in Texas. So if you were involved in an inspection, it would look something like this. The board investigator would show up and present a letter to the doctor, which would detail the purpose of the inspection and discuss HIPAA concerns. The doctor would then be asked to produce 5 exam records while the inspector waited. The inspector would actively then be looking for if there were outward violations of control issues by an optical. This is definitely one of the things that we see year over year where doctors are administered penalties because they are violating some sort of control issue by an optical. The copies of patient records would be reviewed by one of the board members who would ensure compliance with the Texas Optometry Act and board rules. Most violations are met with administrative penalties, as I just mentioned, but some more serious offenses can result in disciplinary action against the optometrist. So it's important we understand what they are looking for and why they issue penalties each year, and I'll go over many of the common types of violations that they find and reasons for the administrative penalties. So here's an example of something that we commonly see, and in fact this is the number one thing I would say that's on the board's list of items that I need to discuss each year. And if you look here, we're looking at a sign outside an office, so this is adult and pediatric optometry. It's listed as Dr. Gerald Smith, optometric glaucoma specialist, and then the suite number there. So most of you, if you've listened to this course before, should be recognizing that there's something wrong here with this picture, and it has to do with the way that the optometrist is identified. Since I first started teaching this course in 2013, this has been the one item that the board has required me to talk about every single year. And the reason for that is that we continue to do it wrong. It is one of the most common reasons that optometrists are issued fines in Texas, and is really defined well in the Healing Arts Practitioner section of the Texas Occupations Code. That's section 104.003. It defines what a medical professional is allowed to call themselves or how they should be designated in Texas. And it's not just for optometry. Each profession has their own subsection that tells how they should be identifying themselves. The designation has to be included anytime you print your name on any sort of literature, on the door, signage, anything like that. So let's go over what that looks like and specifically where you need to use it. Here's that list. Places that you need to use the proper professional designation are the door of the practice and any other signage, business cards, prescription pads, phone book or electronic listings, stationery, and billing invoices. So here are the proper listings for an optometrist in Texas. You may use OD after your name. You may use Doctor of Optometry. You may use optometrist, or you may use doctor followed by optometrist. If you are a therapeutic optometrist, you can use any of the above, the ones that I just mentioned, or you can use therapeutic optometrist after your name, or add that same title with doctor in front of your name. So Dr. Jane Smith, for example, therapeutic optometrist. Well, what about if you're an optometric glaucoma specialist? Well, you're allowed to use one of the previous titles that we just talked about in the previous slide, and then mention optometric glaucoma specialist. You must use both, though. So you can't just say optometric glaucoma specialist, and that's what we're looking for. That's what we're looking at in that picture. The other thing that we commonly see with or without optometric glaucoma specialist is just Dr. John Smith, and you're not identifying yourself as an optometrist in any way. So I think those are important things to remember in order to avoid these fines. Here's some examples of some fines that were given out in 2018. 4 doctors failed to correctly identify as an optometrist on prescriptions. We skip down a couple, we see that that's pretty similar to somebody doing that on a business card. The administrative penalties there are anywhere between $300 and $600, so make sure that anytime your name is written out on anything the public can see that you have yourself correctly identified, as we've just discussed. One doctor was penalized for signing a prescription with a name that was different from the name that was registered with the board. It doesn't really go into any more detail than that, but I would imagine this is somebody who had a legal name change and just didn't update the board. So make sure that if you change your name, the board is aware of that name and they have the correct name registered with them. 2 doctors practiced in offices that did not identify the doctors on signs prior to entry into the office. And so this is a little bit different than just correctly identifying yourself. Here, what the law says is that you need to have your name visible to the public at the entry to the office if you practice at that location for more than 2 consecutive months. And that actually applies to part-time and fill-in doctors as well. So make sure if you're consistently practicing at that same location for 2 or more consecutive months, or more than 2 consecutive months is the way that it's written. So as soon as you hit that two month mark, that's when it'd have to be posted at the entrance to the office. Then finally, 3 doctors were penalized for the use of glaucoma specialists. Just keep in mind again, we can't use glaucoma specialist, but it has to be optometric glaucoma specialist, and even then it must be used in conjunction with one of the approved designations. Let's look at a case study here. So Angelica Pickles OD is interested in increasing her business reach through advertising. She currently leases space next to a large retailer called Walmart, which owns the adjacent optical. In considering her options, she approaches the store manager about the possibility of working with her on advertising. Which of the following is she permitted to do when setting up her advertisement campaign? Is she allowed to ask the manager to place a sign advertising her $59 eye exams near the checkout lanes of the self-service registers? Is she allowed to place her practice name and phone number in the store circular advertisement? Is she allowed to post an advertisement on her practice's Facebook page that uses the address of the Walmart but does not mention the retailer by name? Or is she allowed to ask the Walmart staff to hand out her business cards and set up appointments for interested patients? And if you answered C, that would be correct. And it's important to note, though, that if you use the retailer even as a location landmark, that's actually explicitly prohibited. So you couldn't say, come see me for an eye exam or contact lens fitting or whatever. The office is located next to Walmart. That would be referencing, even as a geographic landmark, the retailer in your advertising, and you're not allowed to do that. However, if you just use the address, that would be acceptable. So in looking at how you can lease space from an optical, Section 351.401 defines that, and it prohibits an optical retailer from controlling the manner of practice of a doctor that leases space from the retailer. According to Section 351.563, every phase of the practice and lease space of the optometric practice must be controlled exclusively by an optometrist. So we have to go all the way back to February of 2012 to find the newsletter that gives us examples of prohibited acts, but these still hold true today. And they include the things that I mentioned in the case study in that example. And again, that third one is the interesting one, probably where some people might fall into a trap there, is referencing a retailer of optical goods in an advertisement by an optometrist, even as a location landmark. So that seems a little bit strange. But you are not allowed to reference that retailer of optical goods in any way when you're advertising your practice. Fines have a minimum penalty of $1,500 per occurrence, so be on the lookout for those. From the 2015 newsletter, we also have some additional advertising issues that we need to be aware of. You need to make sure that you're not throwing out comparisons that can't be substantiated or are misleading. Some examples of that would be that you're advertising the best eye exam in town, or the best pair of glasses you'll ever have. Those things really can't be substantiated. You also have to be careful of unjustified expectations, so guarantees of results would be misleading and a violation of the law. And in laser vision correction, you must define which role that you're serving. And I would imagine this applies really to any type of co-management relationship, even if it's cataract, refractive surgery, laser vision correction, what have you. So if you are participating in that co-management relationship, it needs to be defined either as co-management, evaluation, consultation, things like that, and make sure that the public understands that you're not actually performing the surgery. In the control by an optical section, 4 doctors in 2018 allowed the optical to post signs such that there was no public thoroughfare leading to the entrance of the optometrist practice. So this is really looking at that 2-door rule where the patient would then have to walk through the optical in order to get to the optometrist's office. 3 doctors placed the name of the leasing optical on a business card or a brochure, so you really need to be careful with those things as well here in Texas. Let's discuss some new rules that happened within the last year. So 273.4 increased fees for license renewal in order to cover costs associated with the PMP rules. That's really only a few dollars. You may or may not notice that, but it did increase the fees for license renewal. 277.1 was amended to include requirements to keep a complainant's name confidential, and it added that the board will not accept anonymous complaints, which I believe is a good thing. It allows us, as an optometric community, not to get complaints from people who don't wish to disclose their information. A new rule in 277.11 was created detailing the process for physical or mental examination when necessary to determine fitness practice, and that's something that the board has the authority to do. 273.6 was amended to include licensing procedures for military optometrists volunteering to provide charity care in response to legislation that was passed in 2017. 273.8 amendments that allow restrictions on license renewal if there are unpaid penalties or if the licensee has not complied with board orders or agreements. And finally, 277.12, a new rule setting out the disciplinary actions the board may take, including actions authorized in 2017 amendments to the Optometry Act. Alright, so let's look at another case presentation. A board investigator presents to the office of Dr. John Jacob Jingleheimer Schmidt. Upon presentation of the appropriate paperwork, Dr. Jingleheimer Schmidt produces 5 patient records for review. One record is an examination of a 38-year-old white female that presented for a new patient exam to Dr. Jingleheimer Schmidt's office on August 23, 2018. The patient received a spectacle prescription that same day. Which of the following exam elements is not required to have been recorded during that examination according to Board Rule 277.7? The chief complaint of the patient, the binocular uncorrected or corrected visual acuity of the patient, a biomicroscope examination of the lids, cornea, and sclera, an internal ophthalmoscopic examination, the amplitude or range of accommodation, a tonometry reading, or the extent of the patient's angle of vision to the left and right. So which of those is not required according to Board Rule 277.7? And the correct answer is the binocular uncorrected or corrected visual acuity of the patient. Now, while we do need to record the monocular corrected or uncorrected acuity of the patient, you are not required to record a binocular visual acuity. So here's the actual text from Rule 277.7, the required elements of an initial examination. It's important to keep in mind that these elements apply only to patients who have an initial examination for which an ophthalmic lens prescription is signed. Most of them are pretty straightforward and not surprising at all. I think the things that maybe trip people up are right here around number 10 and 11 and maybe even 13, where you have to do some sort of assessment of binocular function, including what test you used and the endpoint value, as well as the amplitude or range of accommodation expressed in some sort of endpoint value, as well as which test you used. It does not specify which test has to be used. You just need to assess somehow binocular function, and you need to assess somehow accommodation. The other thing the rule says, and it says similar things in the Texas Optometry Act, if you cannot do one of these tests for some reason, that's fine. You just need to make sure that you document that you tried or the reason that you were not able to complete the test. Let's continue that same case study. So now the board notes, upon the record reviews, that Dr. Jingleheimer Schmidt does not frequently specify which fundus lens he's using to examine his patients. Dr. Jingleheimer Schmidt states that he has recently purchased an ultra-wide-field retinal imaging device and reviews all of his patients' retinal photos on his computer. He dilates and examines only those that have a relevant history, complaints, or show retinal pathology on the ultra-wide-field images. Do you expect to see a penalty handed down by the board for this behavior? And the answer is yes. The state law and board rule require that the doctor physically, personally look at the patient's eye. It cannot be done through a photograph or some sort of computer imaging system. What if we ask if Dr. Jingleheimer Schmidt can use the imaging tool for his established patients? Here the answer is yes. The state law and board rule only specify that the doctor must physically examine the eye on the initial patient encounter. So once you've done it once on the initial encounter, it's totally up to your professional judgment whether you want to use imaging tools. But you need to make sure that you're getting out your direct or your 78 or 90 or 66 or Superfield or whatever it is that you have, and you physically look at the patient's eye. So we're going to go into a section here on contact lenses. This is something that we've discussed in the past, but it continues to come up, especially as online contact lens sales and glasses sales continue to grow. So I thought it was important here to address contact lenses, what we can do to help prevent illegal sales, and what the rules actually say. So let's jump in with a contact lens case study. This is directly off of Odie's on Facebook with a name changed in order to protect the innocent or not so innocent. We had a patient call us this morning wanting to know why she couldn't see well out of her new bubble contact lenses. The patient did not have a contact lens exam, and no contact lens prescription was issued. Yes, she ordered her lenses using her eyeglass formula. No attempted verification from Bubble. Ugh, reported to AOA, FTC, FDA again. In order to discuss this case, we really need to discuss the contact lens rule, which at this point in 2019 is now 15 years old. But it's a federal rule that contains two key requirements regarding contact lens prescriptions. The first is that the prescriber, the eye care professional, is required to provide the patient with a copy of the contact lens prescription at the completion of the contact lens fitting. And this really doesn't mean anything about the first visit or the end of the visit. It just means that once the contact lens prescription is finalized and you're ready to dispense that prescription, the patient is required to receive a copy of their prescription. And that's really to just enhance consumer choice and increase competition among contact lens sellers. The second requirement is that the contact lens seller cannot provide the contact lenses to its consumer unless the seller obtains a copy of the prescription or verifies the prescription information with the prescriber through the procedures set forth in the rule. And I'll describe what those procedures are in the next slide. But this requires that anybody who is selling contact lenses contacts you if they do not have the actual prescription, physical prescription. They need to contact the prescriber and verify that information. So let's talk about how they do that. The procedure for contact lens verification as laid out in the rule is as follows. So remember that the seller must contact the prescriber if they do not have an actual copy of the contact lens prescription. If they do so, if they try to contact the prescriber by direct communication, which is considered phone, fax, or email, for verification of a contact lens prescription, and the prescriber does not notify the seller within 8 business hours that the prescription is either expired, inaccurate, or otherwise invalid, the seller is authorized to treat the prescription as verified. It also then defines what business hours are. 8 business hours are defined as 9 to 5, Monday through Friday, excluding federal holidays, in the prescriber's time zone. If the seller determines that a prescriber has regular Saturday hours, those hours may count as well. And this really is defined, so the clock stops when you close, and the clock restarts when you open the next morning. So they can't call you at 4:55 and let 8 hours run. It really has to be your normal business hours, and that excludes, again, federal holidays, and it should be in your time zone as well. This is a quote that I brought up last year in the professional responsibility course, but I put it in here again because I think it's important to hear from the opposition how they feel about the contact lens safety as far as it goes to selling them online. This is a March 2017 article published in The Hill by Tim Devaney. The founder of Lens.com stated that globally, There are many countries like Germany where contact lenses don't require prescriptions. They're sold over the counter. I don't see any Germans walking around with eye patches because they're going blind. He also added that optometry's warnings about the dangers of online contact lens sales are a scare tactic employed by eye doctors to protect their bottom line. So we know there are safety concerns with contact lens sales that happen without prescriptions and without the authority of a doctor. And so it's important that we stay vigilant and report things or negative outcomes as they show up in our offices. It's important that everybody understand, even though it seems like it's a difficult battle to fight, there are ways that we can at least report these problems and have a collective voice. The first two are to the FDA. You can submit MedWatch reports of adverse events, particularly those that are coming with contact lens sales online without a prescription, right here at that top website. You can also notify the Office of Compliance about the illegal sales of contact lenses at that safety link right below that. A third spot to report on the FDA's website is to report the unlawful sales of medical products on the internet, and you go to that top link that I've included for you right there. The button is then there, and you'll report the unlawful sales of contact lenses. And the last website is the FTC, or the Federal Trade Commission's website. You can, on the left side drop-down menu, you click on Other, and then Health and Fitness, and then follow the prompt to submit a contact lens complaint. That one's a little bit more complicated, not quite as straightforward as the others, but it's really pretty easy once you jump on there. Again, Other, Health and Fitness, and then one of the options you'll have will be contact lenses. One of the last topics we're going to discuss today is something that we actually have discussed in the past, but the board thought it was pertinent to bring it up again, and that's social media. Social media impacts your practice in a number of different ways, both positively and negatively, and you really have to be careful how you use it. So what we'll do is we'll discuss some cases, and we'll discuss some social media advantages, disadvantages, pitfalls, how to avoid those types of things, so that you can be as prepared as possible. Let's look at a Facebook case study here. So we see an image here with a fundus photo as well as a blood pressure reading posted on the right. And the caption to the Facebook photo said, a 48-year-old Hispanic male, visual acuity of 20/30 in the right eye, 20/20 in the left, recently discontinued lisinopril HCTZ because he is quote-unquote too poor to buy the medication. Meanwhile, he has a brand new iPhone X, sleeves of tattoos, and a late model Jeep Grand Cherokee. I immediately sent him to the emergency department down the block where he works as a janitor, and subsequently witnessed him turn the wrong direction out of the parking lot. When will people get their priorities straight and learn to take care of themselves? Hashtag enjoy your stroke. In this case, the doctor had friended the patient the previous year on Facebook and had since forgotten. The patient saw the post and recognized their own descriptors, which include age, race, blood pressure measurements, the date of the visit. It actually included, in this case, the patient worked at a specific location, and that made the patient upset. They threatened legal action against the doctor, and they post negative reviews on Google, Yelp, and Healthgrades. So some pitfalls in this case are accepting patients, either past or present, as friends or followers on a personal account. There's absolutely nothing wrong with accepting patients on your business accounts. In fact, that will be encouraged. We want to have patients following, liking our business accounts. But accepting them to personal accounts can be a problem. Be obviously very, very careful with violation of HIPAA. If there are anything that you post about a patient, any sort of medical details, even if it's not directly identifying them with their name or date of birth or anything like that, I think we all would not make those mistakes. But if you have enough information that it's reasonable that you could identify who the patient was, you can fall into this kind of gray HIPAA area. If you post personal, informal, or derogatory comments about patients, that is a tough thing to defend. Be careful, even if you're doing this under a different name or, again, on a personal account. Certainly you don't want to do it on a public page that you link to your business. And be very careful about having the right privacy settings on any of your personal accounts. Make sure that you go into your settings on these social media platforms and ensure that patients are not able to see what you're posting. If you don't want them to, make sure you know which groups are able to see what you're posting. Even posts, or when you like a friend's picture or a picture that you get tagged in, that may be inadvertently seen by a patient. So you need to be really careful with what you're putting out there in regards to personal information. Now, it's not all bad. There are some benefits to social media. It can be a valuable tool for practice marketing and patient communication. A social media study within the past several years here took a look at patients and how they use social media as it relates to healthcare. And so a quote from a patient: "When I was in the ER last night, I tweeted about the interminable wait. Seemed as though people who weren't that sick got whisked in ahead of me. Guess what? Someone from the hospital heard me. They spotted my tweet and responded, and even sent someone down to talk to me in person." So there's an example of how a hospital is communicating with a patient through social media. It can also help patients exchange information if they have similar medical ailments or they need support groups or anything like that. So another quote from that same study said, "Ever since I found out I had diabetes, I posted monthly on Facebook about my struggles managing my blood sugar and energy level. And lots of people, some I don't even know, have swapped healthy recipes, sent me tips on where to buy test strips, and even recommended doctors. Some have even had links on YouTube videos." And so things like that can be important, even starting groups for patients that have certain eye conditions or need somebody to talk to. Certainly can be helpful. You just need to be careful about the other pitfalls that we discussed. So that same study recognizes benefits that those patients were realizing when we looked at those quotes there. For individuals using social media, they can view what others are experiencing in terms of symptoms, reactions to treatments, feeling supported, not feeling alone, joining groups with patients that have similar medical conditions. They can research information. Even there are social media pages where doctors answer patients' questions, and so those can be important. For healthcare companies, it can demonstrate timely and thoughtful responses to problems, understand conversations, behaviors, feelings of patients, reaching new audiences for education and service, and delegating spokespeople and lay referral agents. So this also shows that patients are very likely to share positive health-related experiences, actually a little bit more than negative experiences. And we may think that it might be the other way around, but when they looked at over 1,000 patients and they looked at these different categories as how they reviewed the individual aspects of health coverage, the positive outweighed the negative, and while they're pretty close, it's important to note that the positive is having an impact there. And with things like Yelp and Google, where patients are reviewing your practice, it's important that they have the opportunity to give their positive feedback, and you should encourage patients to do so. Encourage them not only to give that positive feedback, but actively solicit that positive feedback, because it's impactful for your practice growth. Along those lines, here we see that 70% of patients trust the appraisal and criticism in online reviews. And so that's very important. Both the positive and negative impact patients' decisions to come into your practice. Whether or not you personally have a social media page or participate in this actively, there are conversations being had about your practice online. It's important that you do a few things to make sure you are driving patients in and not away from your practice. So those include setting email notifications to ensure that you're aware of all new reviews, looking at competitor reviews to make sure you're understanding which experiences are resonating well with patients, making sure to address negative reviews, mediating those negative reviews through positive private messaging, and acknowledging positive reviews to maintain continued patient affinity. If you're addressing the negative reviews, they give a few tips here. Make sure that you're not mentioning patient information, obviously, so looking at being in compliance with the HIPAA guidelines is always important, but making sure that you are following up on negative reviews and showing concern by apologizing for the experience. So even when the patient is in the wrong, which is a frequent scenario, it's important that you understand that they feel a certain way because of X, Y, and Z, and that you're there to help right the wrong. Across the channels, you don't want to delete any negative reviews or comments. As patients start to see comments disappearing that are not flattering to a practice, they begin to trust it less and less. It is important to make sure that you're addressing those negative reviews in a positive light, however. Some social media do's and don'ts. Well, first, make sure that you do have a social media presence. It puts you at a competitive disadvantage to those practices around you that might have it and are easy to find on social media. Make sure, especially with this millennial generation, that you emphasize community outreach and involvement. Many people in this younger generation really are looking for practices that have some sort of community involvement. Make sure you receive consent from patients to share stories, and along those lines, you should be actively seeking positive reviews. If you don't ask patients for positive reviews, they may not do it on their own. Don't push sales on social media. It's not a sales platform. It's more of a platform to find out about the practice and see what people are saying about the practice from a patient's perspective. Don't compete directly with other doctors. You're indirectly competing because you've got your name out there, but certainly don't bash other doctors or anything else like that. And then don't start a page and forget about it. That's the worst thing to do. If the patient is looking at your page and it's got posts from 3 years ago and it's obvious that you don't even care about the social media platform anymore, that communicates to the patient that there's nothing new happening in the practice. It may even communicate that you're out of business. And so those are important things. Make sure you stay on top of it. Each year we go over the Peer Assistance Program and the Professional Recovery Network. This is an important program that the board asks us to talk about each year, and it's important that as many people as possible know about it. So here in our closing slides here, we'll just review what the Peer Assistance Program and the Professional Recovery Network are all about. So the Professional Recovery Network was established in 1981 by the Texas Pharmacy Association. They were obviously then the first group that was in the Recovery Network. Optometry was added in September of 2010. To date, it has served over 1,000 healthcare professionals. The goal is to help professionals, students, and professional staff in the fields of pharmacy, optometry, dentistry, and veterinary medicine overcome potential impairments due to substance abuse issues or mental illness. The PRN mission statement is as follows. PRN works through confidentiality and trust to educate, prevent, intervene, refer, support, and monitor professionals and students who are experiencing problems that threaten both their well-being and the quality of their professional practice. PRN stresses the importance of approach and focuses on early identification, treatment, and advocacy for program participants. If one is enrolled in the Professional Recovery Network, it's important to note that the reporting and treatment are confidential. The goal is to provide public safety while preventing disciplinary action against the professional license. However, those criteria only apply if the individual who's enrolled complies with their treatment program. Referrals to the Professional Recovery Network can be by oneself, it can be through third party, it can be by an investigator, or it can be through board order. Here you'll see the contact information for the Professional Recovery Network. The PRN hotline is listed there. You can also visit them in person. They're based out of Austin. The website, txprn.com, has information regarding the seminar dates. At the time of this recording, a spring seminar date has not yet been set or listed, but typically there's one in the spring or early summer and one in the fall. Those are opportunities for people to get together in person and discuss anything that might be related to the Professional Recovery Network. So that's all I have for you. I appreciate your time. Thank you very much for sitting down and listening to me. I know this topic and subject matter is relatively dry, so nothing too exciting here, but I wanted to provide you with some contact information. The board contact is Chris Cloris right there. The phone and fax and address are listed, and my contact information is here. The best way to get in contact with me is probably by email. Note that there is no G at the end of my email address, which frequently throws people off. I always like to say that I'm not a lawyer. I have just been tasked with going through the laws that have already been written as they are and conveying that information to Texas optometrists. I will do my absolute best to give you the information as I understand it if you contact me or have any questions, but I don't always have the best answer, and I really can't offer you any legal advice, but I can tell you the way that I understand it. You can also reach out to the board, and they may or may not be able to give you information. A lot of the times what they ask you to do is interpret the law as it's written yourself or ask your own legal counsel, but in some of those gray areas I'm happy to try to give you my best guess, but again, I don't always know for sure. With that, we will end the presentation. Thank you so much again for listening, and we hope to see you back here next year. Take care.